Okay, so we're here with Sidney Ch'ng. She's coming from Sydney, Australia. It's great to have you here, right? It's so good for your visit. So we're going to do mainly facelift and neck lifts, right? Is what you wanted to see. We're going to do one tomorrow, right?
Looking forward.
Yeah, come here. So Sydney is a very experienced head and neck specialist in reconstructive surgery and even in oncologic head and neck surgery. You know, we met last year in the Australian Society of Plastic Surgery meeting that you were in charge of it. And that's, I think, when you started seeing more of my technique for face and neck lift, right? We did a cadaver. And you've also had some time doing this technique. What do you think about this? What do you expect to see tomorrow? Tell me a little bit about all of your journey with this.
I expect to see an expert carry out a deep plane, face and neck lift.
Right.
It is an evolution of my personal surgical career. As you said, I spent more than 10 years, almost 12 in fact, in head and neck, oncologic resection and reconstructive service. And increasingly, I'm drawn to facial aesthetic surgery because it started off with my oncologic patients wanting something more than just longevity.
Right.
I think longevity alone these days is no longer enough. It needs to be longevity paralleled and complemented by quality of life. Mm-hmm. And that is when I started looking at making sure that the reconstructive surgery is as aesthetic as possible.
Right.
And that is how initially I become more interested in plastic surgery.
So of course, this is a great opportunity to see a plastic surgeon that is very specialized in an anatomic area like head and neck, right? Where your origin is really reconstructive surgery, right? It's a thing we've talked about in the past, right? About, you know, when you have this strong background in reconstructive surgery, how do you implement your aesthetic surgery practice with that reconstructive practice?
I think that is a very dated approach to view plastic surgery. I think plastic surgery is in fact form and function, and I think increasingly it's getting blurred. I think surgeons who have got a very solid reconstructive background would eventually, be better aesthetic surgeon. Obviously, I'm biased.
No, I agree completely.
But I also think that is a very dated opinion. Just take football, take soccer. If you play defense, you play defense. If you play forward, you play forward. But these days, modern soccer is different. Modern soccer requires that someone is actually good all-rounder.
Yeah, that's true. No, and definitely when you have that background in reconstructive surgery, you have more confidence in order to undertake some of these more modern techniques that require, deep neck, deep plane face, where you're being close to some very delicate structures where if you don't have that reconstructive background, definitely you're not going to attempt them. And then your aesthetic results are probably not going to be as good, right?
There are actually challenges, not to say that there aren't. It is ironic that oncologic surgery is becoming more and more conservative.
Right.
These days people want minimalist oncologic surgery.
Wow.
And aesthetic surgery is becoming more and more aggressive.
Right.
So that is a very interesting.
That's interesting, Sidney, because let's just remind everyone, Sidney Ch'ng is working in a head and neck department, right? ENT, ear, nose, throat department, which is very kind of unique. No, you work in the department of head and neck surgeons, and you're doing head and neck oncologic resections, and you're doing reconstructive work of your own patients, and also serving as a consultant for the whole department for the reconstructive, more complex cases that you might sort of get involved in or give your input as a plastic surgeon, right? Tell us how that works in terms of a department, because it's very unique. They're not separated, no, you're integrated into that department, right?
So the system in Australia is unique. I have my private practice, and I also have my university and teaching hospital, affiliation. And it's a bit unique because a lot of my head and neck oncology work is actually private.
Wow.
That's the luxury we have. But I'm attached to 3 departments. I'm attached to the head and neck department, the plastic surgery department, and the melanoma and surgical oncology department.
Right.
So just going back to the head and neck department, we are unique because we are a department made up of otolaryngology head and neck surgeons, head and neck surgeons of the general surgery background, as well as maxillofacial surgeons, and obviously, clearly myself, a plastic surgeon.
Right. Wow.
So we each come with our own strengths, and in me, I would like to think that my strengths lies in reconstructive surgery.
Right.
And I would like to also think that one of my greatest strengths is the understanding of the different planes within the face and the neck. Having said that, we work very well as a department. We definitely each approach our head and neck resection and reconstruction slightly differently.
Interesting. And then, because it is an issue that in Australia, the melanoma is a big problem, and skin cancer in general, right? So you will see patients practically in a weekly basis with problems of skin cancer there?
Daily basis.
Really? Wow, that frequent. Wow, yeah.
But there's no doubt that the treatment approach to advanced head and neck skin cancers or advanced skin cancers overall is changing, especially with for cutaneous squamous cell carcinoma with immune checkpoint inhibitor immunotherapy.
Right, that has really changed the landscape of these patients. And then tell me another thing. You know, we've heard also a lot, even here, about the issues in Australia with regulation about social media, before and after pictures. How's that come along? You know, I remember that when I was there last August, there was a lot of talk about that. Is that already, you know, being enforced and it's working well, and you think it's protecting the patients? Because I think it's good that there's so many things going on in social media that I think that it's true that being able to sort of, you know, set some standards and regulations in terms of what those before and after pictures should portray, and avoid images that might sort of change the, you know, bring the expectations of patients with regards to what can be achieved with aesthetic surgery. I think it's interesting, though. So that's already been implemented?
Yeah, those rules are long implemented. As to the effectiveness or whether they have actually served their purpose, that we haven't, well, I'm not aware at least of any audit yet.
I see.
Yeah. So we do have very strict regulations. Before and after photos are actually encouraged, but there are, you know, a set of very strict guidelines. So you're not supposed to, for example, have patients with, you know, before photos without makeup, after photos with makeup.
Good positions.
And lighting and background.
Yeah.
It has to be very standardized.
That's good.
And certain terms not permitted.
Right.
You know, things like mommy makeover.
Oh, even terminology.
Terminology that they think might trivialize.
Right.
Surgery.
Surgical procedure, with a kind of a trademark kind of name. That's interesting, though. I think it's important to protect the patients, and at least to make them aware of this, because again, I think if patients are aware of these issues, then they will themselves kind of, you know, look more carefully regarding the way the before and afters are shown in someone's social media or web pages. And
I think there has to be a very, you know, a fine balance, because what you do not want is the doctors in Australia being so tightly regulated that patients are not aware of what's being offered locally, and had to look elsewhere, because even if the regulations are very tight and very strict in Australia, these regulations are not applied to, you know, practitioners from other countries. And pictures have
that's
to social media
everywhere around the world. That's true.
So
that's true.
I think there has to be a very fine balance.
Right. And talking about balance, that's a great, you know, you just introduced me to what I wanted to ask you about. How do you balance your life with all the issues that you're involved in? You're an academic plastic surgeon. You're involved in research and writing and papers. You have a fellow, you have a fellow in your department.
We have 5 fellows.
In your department. So you're involved in teaching. You're doing reconstructive work. You have a very good, private aesthetic surgery practice as well. So how do you manage all that? You're a mother also. What's your daily schedule? You wake up like at 4 a.m.? Do you not sleep? Or how are you managing that? Tell me, what's your routines?
I certainly, I wish I could do more. There's no doubt that in aspects, I wish that I could actually be more accomplished. But sometimes I take a deep breath and tell myself that I've done my best.
You're involved in these high-level reconstructive meetings. I think you're in World Microsurgery. You're involved in aesthetic surgery meetings, even in different national meetings. You're now speaking in our national society, in a month or so. And
the surgery for facial aesthetic meeting last year in Melbourne was my first aesthetic surgery.
Yeah, but that says a lot. That was some big success. I think it was a great meeting. And you had Mark Ch'ng, and of course Wayne Mendelsohn, and of course the Australian society in general. The plastic surgeons there are very advanced specialists, and they're very well trained in Australia. So I guess that also plays a big part of when there's good content that people will want to go and participate. Because we all learn from those meetings. When you have very experienced audiences, they participate, they give their insights, and it's a very important aspect of our specialty, right? So you're very involved with meetings and lecturing all around the world, right? You've been in California recently. You're now here in Europe. It's a lot, yeah. So you're all around. Tell me how you got into plastic surgery, because definitely you have that background of an oncologic with a lot of knowledge, because all of these new treatments involved a lot of knowledge of these medications, of radiotherapy. You had to know about chemotherapy, immunotherapy as well now. And how do you manage that? So did you more start off with that part and then you've gone more into that plastic surgery part, or you always were more plastics and then you just had evolved in all these other parts because of your head and neck kind of specialty?
I would like to say that I was actually more oncologic to start with.
Really?
Because I have always wanted to be more involved in my patient's journey. Wow. I never wanted to be just a reconstructive.
Just in the OR, not being involved with the patient part of the story and having to deal with the patients. Wow.
I've always wanted to be more involved in my patient's journey. And I think that is actually very important, especially in the field of reconstructive surgery, to maintain our relevance. Because I think increasingly, it's not as acceptable anymore to just be the technician.
Right.
Because you really need to be more involved in the patient's journey. You need to know how to de-escalate surgery. Just because you can cut out something or with bigger margins doesn't mean that you should, because a bigger resection that does not translate into improvement in longevity is a huge disservice to the patient.
Wow.
So I'm always interested in being more holistic in my care. And that is how I actually evolved from being more oncologic to the other end of the spectrum that is aesthetic, because increasingly longevity, survival without quality of life is not acceptable.
Right.
And also that goalpost is, rapidly shifting. One of the neurosurgical fellows that I worked with when I was a fellow used to say this to me. She used to joke that patients would go into surgery diseased, but they would come out maimed.
Wow.
And that stuck with me. That really stuck with me.
Yeah, wow.
I would be the first to admit that I personally, anyway, cannot, in all cases, achieve the kind of standards I hope to achieve for my aesthetic patients in my reconstructive patients. Right. But it doesn't mean that I don't try.
Right. No, definitely no. That's just lie. And I think that your aesthetic results of your reconstructive patients as good as possible. And then again, that turns back into getting your aesthetic results of your aesthetic patients improve because of your knowledge. You're there every day, looking at the facial nerve, right? When you're doing your reparative resections, right? So that sort of confidence on the anatomy that you have definitely allows you to get, I think, better results in aesthetic surgery.
I don't take it for granted, because I have to say that the approach is different, and also the expectations are different.
Yeah,
right?
That's true.
In a way, I enjoy it because it's a whole new frontier for me, and I like the technical challenge, and I like the precision. I like the perfection.
Yeah, no, it's true. That aesthetic surgery has in facial, and neck rejuvenation, it's exactly, you're right. All these little details and nuances are so important. Just like reconstructive microsurgery, if you put a stitch that's too tight, the whole surgery might fail, right? So I think the same way for aesthetic surgery, there's so much attention to detail.
But the benchmark is so subjective. That's one thing, that is very different from oncology reconstructive surgery.
Oh, right.
In cancer surgery, you either have macroscopically complete excision, microscopically complete excision. In microsurgery, it's either your anastomosis works on
Or does it, yeah.
But in facial aesthetic surgery, the benchmark is harder. There is no one standard. And one standard that is actually good for one patient doesn't necessarily apply to the next patient.
I agree, Sidney, and I think that's why the standard you set yourself as surgeon is what has to guide you there, not really the patient's expectations. Because if not, then a patient might say, "Oh, doctor, I'm fine just with a little improvement there," and then then you'll do something for them that really is sort of a disservice to a good result, right? And that's where you have to understand what you are looking for in terms of the result you want to achieve, and make sure that you don't stray away too much. You can alter it a little bit, depending on patients wanting more or less kind of evident results or not. But I think that once you, like you were saying, once you understand beauty and what makes, a perfect, what you were saying, a perfect young and attractive face or neck, once you understand that, it's very hard to sort of accept lower standards. So I think that it's true that you need to have that journey of going through your standards of beauty and attractiveness and youthfulness and what you want to achieve, and then trying to provide that to your patients, and being able to, like you were saying before, to advise them on what they should look for, right? Just like you're doing with also your reconstructive patients, where you might say, okay, we're not going to do this, we're going to do this other treatment because that's going to be best for you. And I agree with you totally. You need to have this position as not as a technician, not as someone that does what you're told to do, but as someone that can provide that value to the patient in terms of really guiding them. Although many of them are very knowledgeable and they do their homework and they research techniques, sometimes you need to really advise them in terms of what's best for them, right? And I think that you're doing it also in your reconstructive patients, and I think we should do it also in aesthetic surgery, right? But yeah, so Sidney, really, it's been such a pleasure. Sidney Ch'ng, she's, everybody, I think, everybody knows that you're definitely the most well-rounded surgeon, like you were saying, in terms of reconstructive, with that balance of reconstructive and aesthetic surgery knowledge in the head and neck, of course, because as you were saying, it's hard to be you had to be all rounded. It's hard to be that in sort of body contouring and also breast surgery and rhinoplasty. So I think that definitely you're in that area, which is very, very unique and needs a lot of like head and neck oncology, head and neck cancer, or head and neck reconstructive surgery and microsurgery, and also aesthetic surgery of the face and neck. So definitely you are one of those individuals that have that ability to really excel in both fields, and you're just getting started. Okay, I mean, I know it's 10 years, and so, but exactly.
I make no pretense.
Yeah, no.
It takes a long time to be good in it.
Yeah, man.
And I thoroughly enjoyed my journey, but I'm equally looking forward to you
continue. Yeah, the journey doesn't never end. I'm on a journey as well, trying to improve our results that we're getting and providing our patients, and definitely you've gone a long way, because definitely in the reconstructive arena, and definitely you've done incredible papers, and you're still working with very important research on head and neck skin cancer, right?
But do you really think that there are such clear-cut categories, whether one is reconstructive versus aesthetic? I think it's a bit more blurred than that.
I agree with you, Sidney. I think many of us that are now more involved in aesthetic surgery, have had, I myself had a very strong background in microsurgery and reconstructive surgery for many years. And I still do complex reconstructive cases. So I think they work together. And I think, as you're saying, those boundaries that oftentimes we create ourselves for well-trained plastic surgeons that have a very strong background in reconstructive surgery.
I think that differentiation is to a large part arbitrary, and it's because it's being dictated by reimbursement.
Oh, right.
Private health insurance, government reimbursement. I think that to a large extent has arbitrarily drawn that differentiation
Separation,
between
right.
reconstructive and aesthetic surgery.
Oh, definitely.
And I certainly see that, it's a lot more intertwined.
Right. No, I agree with you completely, Sidney. So now again, a pleasure to have you. I'm looking forward to tomorrow to having you in my OR. We're going to do that interesting face and neck lift case, and looking forward to seeing you again in all around the world in meetings, because I know we have been able to share some of the meetings already. So looking forward to it. Okay.
Thank you.
Muchas gracias, Sidney. Okay.